Thanks, ACNJ, for organizing this. I'm going to not repeat things that you already heard much more eloquently from our parents, providers, from some of our legislative members, from Winifred, and just say a couple things. Remember COVID? Right, not too long ago, we already have research evidence that when parents don't have access to childcare, and there were heroes during that moment. So this is not a diss to childcare providers because a lot of you were there. But in the beginning, and in those kind of scary, I don't know, I want to say years, it wasn't just months, we saw parents, particularly essential workers. Remember those? What we used to call essential workers and how we cared about them for half a minute? People that don't have the luxury, like me, quite frankly, of letting my kids run amok while I'm working from home in my cool basement or my attic when it's hot or when it's cool. Anyway, I do the reverse. Now it's summer, so I'm in my basement. And so those parents, we have the research evidence, which of course this administration stopped collecting, the federal administration, that when parents, they were losing hours of work and they were losing jobs altogether. So whoever said that earlier, that's in some of our reports from during COVID. That will happen, and this has a disproportionate impact on women, particularly black and brown women, but quite frankly, all women. And also employers, our providers. It's like my heart drops when I heard from, I'm not going to remember folks' names. I want to say Princeton, Sue from South Jersey, right? You both have significant amount of, I don't want to say clients, kids. I'm not from childcare, if you can't tell, okay? But families, thank you. You have families who, are going to lose out. These are not wealthy families. These aren't families that are, not taking a vacation. They're not giving up their vacation money or their savings to pay a copay. What's going to happen is those providers are going to be stuck with eating that copay, probably, or having to make really tough calls with families who don't have a savings. So the other thing I was going to say, I listen to this station called WNYC. It's a national public radio station. Every morning it's my ritual. I drink my coffee. I listen to WNYC about the news, mostly in New York, but then sometimes they cover New Jersey. And I heard, actually this was in the evening, I'm lying. So it was dinner time, and I was by myself having dinner because my family was all out. And I was listening to a show called Ask the Governor. Once a month they have that. It was in July. And the governor is being interviewed. The budget had just passed, and he was bragging about how when he started there was only a $400 million surplus, and he was very proud of the $6.7 billion surplus we now enjoy. I get it. I like to have a savings. My kids are 21 and 24, just done with college. I'm done with daycare. I actually have a little savings for the first time in my life. And it's a rainy day fund. But if my roof was caving in or the foundation was cracking, I'd have to take money out of the bank. And that's what this is. This is like literally raining down on our families that are barely making ends meet. They're in the workforce, working jobs, by the way, that the employers will complain they can't find workers, right? Because these are low wage employees too, which is the other thing we aren't saying, who often have unpredictable hours. Another person here, I forget your name, or I think it was you, or someone was saying, these child care providers also aren't really getting their full wage, where they're a family child care provider, right? They're not, this is a whole other conversation we don't have time for, because seriously, I know y'all want dinner, and those of you with little ones, bedtime. But Winifred, Megan, Cindy have really educated me about the real cost of care. Which is more like $25,000 of infant care. Our research doesn't say that. But if you take into account paying workers, right, offering them retirement benefits, all those things. So this is not even the subsidy issue. This is just the brokenness of the child care system. So this is the bare minimum New Jersey can do, is to keep this program whole. And then we should start to look to other states who have lifted this program and made subsidies accessible to people. I know this is crazy, but I'm allowed to say this. I know this is a crisis. We need to solve this like yesterday. But really, we're one of the stingiest states with this program as it is. And that's not, we've made progress. But we should be at 300 or 400% above the federal poverty line, and reaching working class parents as well. And that's what, other states have done it. It's not easy. It's kind of a midterm and long-term advocacy investment, and that's really why we started the First 1,000 Days Policy Coalition, not just the subsidy, but ACNJ and some of you in this room have been advocating down in Trenton and with legislators alone. And this is not an issue that only affects you or providers, it affects the whole economy. So the First 1,000 Days Policy Coalition is a group of advocates, researchers, includes ACNJ and AJC, educators and other community leaders working to make sure that safe, nurturing, and consistent childcare is accessible and affordable for everyone. And so we know, we want to join with those of you who have already been advocating and getting business and industry and getting labor unions and getting community organizations to recognize the value of care, the value of early childhood workers, et cetera. And also, we have the research at the Center for Women and Work at Rutgers. I should talk about the center for 2 seconds. And we, of course, have research evidence to guide this. But I think the testimony here really says it all. So I'm going to stop talking. We will have ways for you to get involved in the coalition coming soon. And did I leave anything out, Winifred? I hope you all have a good evening. It's like cooler up here. It's like there's air conditioning. I think the breeze is coming in. Thank you.